I Heart Midwives is all about why midwifery matters. So if you're pregnant, looking to become pregnant, someone with a uterus, or even care about someone with a uterus, these conversations are going to be relevant to your life. Hi, I'm Cheryl Fuder, a practicing midwife, certified homeopath, educator, and health coach. I believe deeply in the midwifery model of care, where pregnant women and people are fully listened to, their provider gets to know them as a person beyond numbers on a chart, and a place where continuity of care is a normal part of pregnancy, birth, and postpartum. Join us for stories on the history of midwifery, modern midwifery, pregnancy, birth, postpartum, and midwife life hacks. Subscribe for new episodes and share why you love midwifery in the comments. Let's dive in. Today, our guest is Julie. Julie, would you like to share a little bit about yourself?
Hi, I am Julie Allick. I am a doula. I work alongside midwives as well as OBs and nurses in the hospital. I've been doing it since 2019, and I came from a previous career where I learned how to hold space and help people through intimate moments, and then decided that I wanted to use that talent to help people in the most intimate moment, which is birthing their children, And so I am excited to be here and talk about midwifery and all of birth stuff.
Thank you. I'd love to dive in about your background and everything. But first, let's start out with, why do you love midwifery?
I love midwifery because to me, it feels like it really normalizes everything that happens in pregnancy, birth, and postpartum. I feel like somehow it's gotten very medicalized, and that birthing our babies is a medical event. And that can bring up a lot of fear for clients that I've noticed. And midwifery, the whole model of care, from my understanding, really normalizes it, and it makes it feel accessible. Like this is something that our bodies are meant to do, that it's safe to do what our bodies need to do. And I think it really helps people in a mental, emotional, and physical way.
Yeah. And I love that piece that you bring up about the normality of it, that midwifery is really based on the normal physiological process of pregnancy, birth, and postpartum. And in many developed countries, midwifery is the first level of care that everyone gets. And then if there are, pre-existing health conditions or complications that arise during the pregnancy or the birth or the postpartum period that is outside the scope of the midwife, then obstetrician gets brought in on the team. And it's more of a collaborative care than these parsed pieces of care that we experience.
Yeah, and that makes sense to me. I've watched a lot of, like, some of my favorite shows are period pieces where it's midwives providing the care.
Call the Midwife by chance?
Yeah, one of them, just one of many, where it's like, that's just what you do. You call the midwives who have the experience, who have the education and have the care, and it's not some big medical event unless it needs to be. And in that case, we're very grateful for those members of the team, but they don't, like you were saying, they don't take over all of the care. They come in as a team member.
Mm-hmm. Yeah. And being a doula is a really important part of the team as well. And so you started doula-ing in 2019. Tell us a little bit more about what brought you into that and how you transitioned from your previous work into becoming a doula.
Yeah, so I would like to start saying that I love being a professional doula and being part of the team. That's one of my favorite things about working with midwives, is that I feel accepted as part of the care team. I don't think I've ever had an obstetrician pull me out in the hallway of the hospital and be like, oh, I think the baby is coming down in a weird angle. Do you have any tips or tricks or things that you know how to do? Whereas midwives, it's more of like, this is the situation. Hey, Julie, what do you think? How can we work together? And I love that team aspect. So my previous career was actually in sexual health and wellness. And so I really did learn how to hold space for people in those intimate moments and be able to make people feel safe and help through a lot of those things. And then through my own journey of doing that work and finding myself as a woman and a mother and raising a daughter, I got really passionate about the things that our bodies can do and how amazing it all is. And I got very passionate about not only learning for myself, but then teaching my daughter. And then I realized that this is something that I could help more people with. A lot of us, maybe like me, didn't have the conversation with our moms or our the women that came before us to say, this is how your body works. This is how your period works. This is what it means. This is why it's an okay thing. It's not dirty. It's not bad. All the way through birth, I never got that. And to say, like, I'm not the only person who had that sort of exposure to it, and I can help people learn more and feel more comfortable and educated about their bodies, their normal processes, and have a good, positive experience.
Gosh, wow. Yeah, that piece around the stories that are told about our bodies and to our bodies, the stories that we absorb, I think that plays a huge part of the maternal healthcare system in, that your uterus is going to expire, the placenta is going to expire, your vagina isn't a safe place to birth your baby through. There's like so many messages that are integrated into the healthcare system around childbearing specifically, and I'm sure in other places as well. But this piece around, sexual health and wellness and how that ties in so intimately and caringly into pregnancy and birth and postpartum as well. Wow.
Yeah. And the thing is that midwifery allows for more time with your medical provider. It allows more time for these conversations to come up. If there's trauma or any sort of history, or even just that, when I had my daughter, I was like, well, I don't understand how this all works. There's more time for that education piece for the patients and clients to be more educated and feel more confident about what their body can do, be reminded that it was built to do this, and to have happy, healthy birthing experiences.
Absolutely. Yeah, I love that. So you shared a story of how midwives will often bring the other care providers on the team. So, as a doula, maybe childbirth educators, physical therapists or other referrals. I feel like as a midwife, that's one of my tools in my handbag, is that I have, other support people, other professionals that I can call on that can also help support my client. Maybe not every client needs acupuncture or aromatherapy, but at least I know professionals that can actually really benefit my clients when I kind of hear that that's something that would really benefit them.
Yeah.
Do you have other stories of how you've kind of seen midwifery in action and in caring for your clients?
Yeah, I love what you talk about and having referrals. I think it's a really important piece about being a really confident professional birth worker, to know when our scope of practice begins and ends, or where something isn't best suited for me, or where somebody else, another practitioner, can help add to this piece, and I love that you share that of like, yeah, maybe not everybody needs acupuncture, but if they do, this can be really helpful. And to work with a team of professionals and build up and surround the client or patient and to help them have these good experiences. I love being able to go to the midwives that I work with. If I'm thinking about, okay, the baby's doing this, maybe the body needs to do this. How can we help move this? And to go to the midwives and to just have that support and the teamwork to say, I'm thinking this because of this. What do you think? And that they'll come to me with that same thing of like, we all have a lot of education and a lot of training in what we do, and we fit so well together. And I love that I don't come up against like a whole ton of ego with midwives being like, I know how to do everything. It's not like that. It's more of like, yes, you are a valuable part of the team as the doula too. How can we all work together? So I have a lot of stories of just those experiences of, hey, I'm thinking this. What do you think? Oh, hey, what station is the baby at? Because then maybe we could do this and help the baby descend, working together in that team aspect where it's not always that way in a hospital setting with obstetrician.
Yeah, unfortunately not, right?
Yeah.
And I love that piece around being a doula and, really being there with every breath, every contraction. And, as midwives, I'm thinking about a multitude of things around the health of the mom, the health of the baby, the progress, really making sure that everyone's making it through the transition well. And so as the doula, being able to provide that additional support. And it made me think about how, as birth professionals, we have a map of common, the way that pregnancy and birth and really works. And we'll talk about birth specifically here. But we have this map, and we understand the map, and we've seen it work. And yet every single birth has its differences, even
Right.
with the same person, even with twins. The first baby might not be the same as the second baby.
Right.
And so, for us to be able to share resources and share wisdom among each other, I think just ultimately just benefits the birthing person, the client or the patient. And so that is just really highlighted in what you said, and made me really think about just how important that shared wisdom in the community and in the birthing space really, really is. So
yeah, it's so great to be able to work alongside the medical providers, the midwives, and feel like we're all there for the same reason. And it was kind of an adjustment going from like, all of my beginning experience as a doula was in the hospital, and I felt I had to often be very defensive or assertive, and I didn't want to be that doula that we've all heard stories about, but to just like establish that, hey, doctor, nurse, whoever it is, I'm a professional too, and I'm here to be part of the team. How can we all do this? And sometimes you have to win them over with kindness or really show them that you know what you're doing. And I understand that maybe some doulas before me haven't set the best tone or whatever it is, but the big shock to me was going to work in a birth center with a team of midwives who there was none of that. It was just open arms of like, yes, come help us. Things that maybe we're not going to be thinking about because we're thinking about how that map needs to unfold and how to safely have the baby, because you're liable for the health of them, more so than I am. And so that was such an adjustment to come into a team of midwives that are like, yes, you're here. Let us all work together for this one beautiful outcome,
Mm-hmm. Yeah. And gosh, it's, one of my missions is to help make midwifery mainstream again. And I feel like part of that path is making sure that doulas are part of the team as well. And, integrating all of those pieces into every birth at the hospital.
Yeah.
And again, I understand the pressures that the nursing staff have and the on-call providers. I understand that. And I think that there could be a lot more grace and gratitude and collaboration happening at every birth and within each system as well. And really it just winds up benefiting moms and babies. There was a study I read years ago that it, in some ways, it sort of reassured me quite a bit. But when I was a new student midwife and new doula as well, and it was a study that showed that just having another woman is how they did the study. I don't know what that would look like for non-binary and trans. It wasn't included in this particular study, but that would be interesting if anyone is out there researching in the world.
Right.
But just having another woman in the room of the birthing person, like decreased pain, need for pain management, induction, cesareans, like all of these really positive birth outcomes were increased by literally just having another woman in the room who like could have just been sitting in the corner. I think the study just had somebody sitting in the corner, not interacting at all. But there's a piece around, in my interpretation of that, is that there's a piece around like continuity and about having someone else there. And like I said, in the study, they weren't like being like, I care for you. But when you're surrounded by a team of people who you know have your best interest in heart, who are caring for you, who you've developed trust with, you've developed continuity with, you've met them beforehand, possibly. There's something about that is the midwifery model of care, but it brings in that piece of being able to birth your baby really in a safe environment.
Yeah. And the whole model of care during the prenatal appointments, you get the opportunity to build a connection with the birthing person and they with you. And it's not like a 15-minute in and out appointment. You spend more time getting to know them, making them feel comfortable. And then in the birth space, I've seen such contrary things where in the hospital, I arrive to support my client and nobody's in the room with them. It's just them and their partner. And to have anybody just be there with them, like the study, how that could affect their comfort level, their safety, whereas like working with midwives, understandably, there's always things to be done, but your main focus at the time is that birth and how to help them. And so I think a huge piece of comfort and good birthing experiences is having that continuity of care and having somebody by their side, whether it's the doula, the midwife, hopefully both, having a good big team of support. And then even helping the partners support in a way that they might not know how to support or they might not feel confident in doing, where then you have everybody there supporting the birthing person and hopefully having a good outcome.
Yeah. And I love that you just brought up partners too, because something that I often tell partners is that they know their partner better than anyone else does. And, they know how they are when they're sick, what they want when they're not feeling well, if they're, they have some mood happening, they know how to support them in the best way as an adult, even sometimes more than the birthing person's parents or other people. And I just really love that assurance and like support that we bring in on the partner too. So, we're talking a lot about midwives and doulas as a collaboration and a team, and also the partner is part of that team as well. And I love how doulas support the partner. I love how midwives support the partner. Like we all have our ways of kind of loving them and bringing them in on the journey as well in their becoming a parent. And so it's just so beautiful.
It is. And it feels much more like I keep saying a team. I worked with a couple and I was talking to the dad about how he can support with massage and counter pressure and supporting his wife and doing all of these things. And he was blown away. He was like, what, like I get to hands-on support her? And I'm like, totally, like, please, I want you as involved as you can be. It's not my baby that's being born, it's your baby being born. I want you involved, and how the midwifery model of care and midwives in general support that of like, yes, partner, come in. This is your baby. This is your experience. We're here to support all of you, you know. It's so nice.
I love that.
Yeah.
It So I just thought of this, and I love this question because there's so many different ways of answering it. But so a question that I get a lot, and I suspect you do as well, is what share with us your explanation of what the difference between a midwife and a doula is.
Okay, yeah. And that happens a lot because people are like, well, what do you do? And what do you do? Who am I supposed to call? I break it down to that the midwives are in charge of the medical care, first and foremost. So while a good doula has a lot of medical training, I just say that, like, I'm not certified to do anything medical. I can help interpret medical things. I can help you know what to expect. I can help explain what's happening in medical situations. But the medical care is on the midwife. And so, and then it gets a little blurry from there as far as like midwives offer support and comfort, physical and emotional, and the education piece, as well as doulas. But then to say, kind of how you said earlier, of like, your main focus is the health and wellness and successful delivery of that baby. And then that's where the doula can come in to help support the midwife and the team of birthing people, and to say like, okay, midwife mind is on the baby's heart rate right now. I can offer comfort on this part. So it's having both pieces.
Mm-hmm. The doulas and midwives, how we support our clients, and we work in a team and collaboration. And the thing that I really just inspired me to really touch upon is this one-to-one care. And so, like, as a doula, you're usually with your one set of clients. You're not like jumping between, let's
Right.
say at a birth center or at a hospital where there's several people birthing, in the facility. You're not going to be jumping from like one client to the next client to the next client.
Right.
At a birthing center or hospital, they might be caring for a couple clients at the same time. And that's where like having your input as the person they're birthing with them is really valuable. And why midwives, we're like, no, you're with them. We know what that's like. As a home birth provider, I'm there one-on-one as well. And so I only practice home birth settings, but so I'm not like driving from house to house.
Yeah.
I'm like, oh my gosh. But I think that there's such a huge piece around that, that midwives really understand, of being like a one-to-one care provider, and why there's so much collaboration and value in the midwife doula team that we're talking about here.
Especially doing home birth, like, you are their person.
Yeah.
If they don't have a doula, you are their one person. You are their rock. You are their guidance. You are their support. You're all of the medical things. You're the everything, And so in that sense, I think it would be beneficial even for you as a home birth midwife to have a doula to help share some of that weight and those responsibilities of like, hey, wonderful doula that I'm working with, can you help me do this and do that, or get me that and get me this? And so that way you can focus deeply on the support that you need to give and have that additional help too.
Mm-hmm. Yeah. Yeah, definitely. I love that. I'm curious if you have any like life lessons that you've learned from being a birth professional, working with midwives and how that maybe has impacted you in your life.
We don't have enough time for all of the lessons that I have learned being a birth worker. I think the biggest one is that I like to say that I'm like a recovering type A person, because even my previous job in sexual health and wellness, it was very like sometimes office work, like type A, like get this done, hit this number, do this thing, structured. And going into birth work where very little is structured, very little is predictable, and just kind of throwing my hands up and going, well, the baby's going to do what the baby wants to do, and it's been very freeing, honestly, to release some of that control. And that's from helping so many people birth their babies and teaching them that lesson of like, you can't control every aspect of this, and helping them understand with that education piece of the need to let go a little bit and let things unfold in the way that they are going to, and to trust in their body's wisdom. And that has affected me of like how I listen to my body now, how I support myself now going through anything that is challenging in my life, to take a step back and support myself the way that I would a client, and to say, this is a normal experience. These are normal feelings, and this is how we can get through that. And then, of course, it's melted out into how I parent and how I love my husband and how I support my friends in a much softer way. I think it has softened me.
Oh my goodness, that's such a beautiful story, and thank you for sharing those lessons. I think that they're so loving in so many ways.
Yeah.
So, Julie, would you mind telling us where people can find you? Can we follow you on Instagram or Facebook? Like, let us know where in the world you are.
I am everywhere. Yeah. So on Instagram, I am at Julie Has Arrived. And I love that name. It's something that I picked before I even got into birth work, and it feels like it just the sense of relief sometimes that I feel when people are like, Julie's here, the doula's here. So I kept that. It's Julie Has Arrived, and it's not strictly work stuff that I post on there. It really is me, authentically me.
It really matches your life lessons too that you just shared with us.
Yeah. I feel like it's a good representation. And then I do have a website that is modernmatriarchdoula.com, and that has my birth, postpartum packages, things that people can read more about me.
Mm-hmm. And you're in Thornton, Colorado.
I am in Thornton, so I serve pretty much anywhere that I can get within 2 hours. I support hospital,
wow.
home birth, midwives, of course, birth centers, pretty much anywhere that I can get and be safe and get there, especially in Colorado with the weather. But yeah.
Oh, that's lovely. Yeah. So we'll be sure to put those links in the notes below. And I just really appreciate you being here. And thank you so much for sharing about why you love midwives.
Yeah, thanks for having me. And I hope that we can reach a lot of people and make midwifery more common and understandable and easily accessible.
Me too.